Well, humans aren't the only ones who suffer from bronchitis and COPD. More and more dogs are experiencing airway diseases.
And Dr. Jay Erne is a board-certified specialist in surgery at the Affiliated Veterinary Specialists. And for those of us who might not know about what Affiliated Veterinary Specialists, what they're all about, good to see you, Dr. Erne. Thanks for being here. Let's talk a little bit about the pets that you treat and what you guys are all about.
Yeah, so we're a group of surgical specialists, so we're all specially trained to do a wide range of orthopedic and soft tissue type surgeries, a lot of things that your family veterinarian may not do. So,
and what about your specific role with them?
Yeah, so I'm one of the board certified small animal surgeons with our group. So, I see consultations with clients to discuss these conditions and if their pet needs surgery.
And what are some of the services, what are some of the procedures that you perform? I know you guys are specialized, so what point in time would someone come to see you and what would you be doing?
Well, it kind of depends on the condition of the dog. You know, we see orthopedic conditions as well as soft tissue conditions, which would include the stomach, intestinal tract, breathing problems, those sort of things as well. But majority of what we do is orthopedic conditions.
All right, so we led in with it about, the lungs and bronchitis and COPD and stuff like that. So talk about some of the airway kind of obstruction cases you guys are facing right now.
Yeah, this is a tough time of year for dogs because of the heat.
Yeah.
And so one of the specific conditions that we deal with quite a bit is called Brachycephalic airway syndrome, and those would include dogs that are the bulldog breeds where they have the real scrunched up face. And what their problem is at the back of their throat, they have a lot of tissue back there that will obstruct their airway. So this time of year when they're out playing around and
breathing real heavy,
they get a lot of heat buildup, a lot of swelling, and then they start to go into a crisis. And the other condition that we'll see is a condition called laryngeal paralysis. And we see that a lot in older dogs where their larynx, which is needed for them to get air into their lungs, gets paralyzed.
Oh, wow.
So,
what are some of the symptoms? What do we need to be on the lookout for either one? I mean, was the first one specifically breed specific? So if you notice, you might have a knowledge that your pet might be susceptible to that. But with the second, the older pets, what do we need to be on the lookout for?
Yeah, so typically the laryngeal paralysis condition occurs in older Labradors. So if you have a Labrador and they're reaching 10 years of age and you start to see a change in their breathing pattern where they're getting this very noisy, raspy breathing, sometimes they start to have a change in their bark as well, or they gag, almost as though they're vomiting something up. That's a very good indication that they're developing that condition. And it's a very progressive problem, so it starts off not so bad, and then it gets worse over time.
Well, we were talking before, I have a beagle, and the long snout, but you said the breeds that it's common with is the kind of scrunched up faces, but there's times where Brew, he'll just start hacking, and my vet was saying it's because there'll be something in the sinus cavity. What do you guys do to treat this?
Yeah, so with the bulldog breeds or the brachycephalic dogs, oftentimes what we end up having to do is shorten their soft palate, which is a piece of tissue in the back of their throat that's just too long for them, so it just obstructs their ability to breathe. So oftentimes we have to shorten that up a little bit, and then the other problem that they have is that their nose, oftentimes the opening to their nose is very narrow, so we have to open that up a little bit as well to get them to breathe better.
And the condition that you said affects older dogs, and it starts out very mild but then progresses. Is there a treatment for that disease?
Yes. Yeah, there is a surgical treatment for that, and it's one of those procedures that the dogs feel so much better after that surgery. It's a lot of dogs have been walking around breathing like that for years, and the minute you give them a much better ability to breathe and oxygenate, they feel tons better. So your 10-year-old lab will all of a sudden start acting like a 8 or 7-year-old lab.
And is it persistent? Just you notice it. It's just a very laborious breathe. I mean, it's just something that you notice this isn't right. It's not like the occasional
breathing.
Loud breathing.
So when they're out walking around, it's just a that's the type of breathing that they start to have, and it's a little bit disconcerting. And in the heat like this, they will potentially have collapsing episodes and start to almost look like they're suffocating, which requires emergency treatment.
And so, we talk about this you guys are not your normal vet, and so for
Right.
people that might be seeing those signs and stuff, they should go to their vet first, and then they'll get
Absolutely.
referred to you guys, right?
Absolutely, yeah. So, that's important, is that your family vet is going to be your first line of defense,
Yeah.
and they know how to treat emergency situations like that. But after the pet gets stabilized, then oftentimes you'll be heading our way to have
Yeah.
the surgery done. Yeah.
All right. Well, thank you
Yeah.
for being here. We
Okay.
appreciate your
Well, I appreciate
perspective
it.
and advice, and I'm sure a lot of pet owners ears
Yeah.
are perked and they're listening to make sure they're taking good care of their pets, to
Absolutely.
know there's a solution.
Yes.
All right, and we'd like to thank Affiliated
Okay.
Veterinary Specialists for sponsoring this segment. For more information, you can visit avspethospitals.com. You can also visit the Jacksonville location by calling the number 904-646-1287. The Orange Park location, the number is 904-278-0287.